We start with COVID-19 and Governor Abbott addressing a new record in the number of cases. You saw his news conference on CBS 11 this afternoon. Our Jack Fink live for us in Dallas now with our top story at 4 o'clock. Jack?
Well, Ken, Governor Abbott says there are more than 2,600 additional cases of COVID-19 across the state today compared to yesterday. There are more than 2,500 people being treated for the virus in hospitals across the state. And the governor, though, is still insisting the state is in good shape when it comes to the number of hospital beds. There are nearly 15,000 beds available statewide. Now, when it comes to our region in North Texas, serving about nearly 7.9 million people, there are a total of more than 14,000 hospital beds. There are nearly 3,400 beds still available in the region, along with 525 available ICU beds and nearly 1,300 ventilators available. In our region, there are about 765 people in the hospital who are being treated for COVID-19. The governor says hospital CEOs in the state are watching levels very closely and that the threat level for hospitals remains at its lowest level, even with rising cases.
The increased occupancy of hospital beds, it does raise concerns, but as shown today, there's no reason right now to be alarmed.
The governor says hospitals are better prepared to deal with COVID-19 than back in March. He also says Texans have a responsibility to continue practicing social distancing, wearing their masks, and covering their faces when they cough and sneeze. Ken?
Jack, what did the governor have to say about why these cases are on the rise?
Well, the governor did say that they have watched these cases rise since Memorial Day weekend, in part for some of the activities, but also because testing has increased at state prisons and nursing home facilities for residents and employees. He also blamed people younger than 30 for congregating at bars and not practicing social distancing. And he said just yesterday the state sent a warning to bars and restaurants that serve alcohol that if they aren't following the state guidelines, they risk facing losing their liquor license for 30 days, and if it happens again, for 60 days after that. Ken?
Well, all right, Jack. Well, thank you very much. We appreciate the update.